मरहबा, हेलो एवरीवन, नमस्कार। आई एम डॉक्टर पराग तेलंग। मैं एक बोर्ड सर्टिफाइड प्लास्टिक सर्जन आहे और मैं इंडिया में मुंबई में प्रैक्टिस करता हूँ। आई कंसल्ट एट बुर्जिल अलरीम इन अबू धाबी। For eyelid rejuvenation, we have something called as a blepharoplasty, which is to remove the loose skin either from upper eyelid or the lower eyelid. We have injectables such as botulinum toxin and dermal fillers, which can be used to get rid of the under eye hollows and for the wrinkles around the eyes. Eyebrow lift is also an option. Sometimes the eyebrows tend to droop down, and lifting the eyebrows makes the eyes look bigger, and it gives a wonderful rejuvenation to the eyelid area. You are a good candidate to opt for eyelid rejuvenation when either you have sagging on the eyelids, there could be puffiness in the under eye area, if you have too much of wrinkles around the eyes, or if you feel that the eyelid area looks tired even after adequate sleep and rest. You are also a good candidate for eyelid rejuvenation if the under eye area skin has become dark or if there are any fine lines that are appearing in the under eye area. Sometimes there is excess wrinkling skin on the eyelids, there may be droopiness on the eyelids. In some individuals there may be asymmetry in both the eyes. Of course, there are different set of individuals who have a missing upper eyelid crease, and we do a different blepharoplasty called as an Asian eyelid surgery for these individuals. A surgical alternative for rejuvenating the eyelids is mainly for two reasons. If somebody has a very minimal droopiness or sagging in the eyelids, only then it can be corrected by the non-surgical alternatives. But if the amount of droopiness and sagging is too much, then surgical treatments are considered to be the gold standard. Also, if an individual is not yet ready to undergo a surgery, they can try the non-surgical alternatives which are available, which will give them a short-term benefit. If they like the outcome of these non-surgical treatments, they can later on opt for a surgical alternative which will give them a more permanent kind of a look. For undergoing any procedure for the eyelids, a person has to be in a good physical and mental and emotional health. Of course, those of you who have conditions such as thyroid, blood pressure or diabetes, all these conditions need to be under control. You should not be on any blood thinners such as aspirin or ibuprofen, and they need to be stopped before the surgery. Those of you who are smokers and consume alcohol need to stop smoking or having alcohol at least 3 weeks prior to these surgeries, and then you can safely undergo these treatments. The individual should also not have an active eye disease or some infection when they plan this surgery. Eyelid rejuvenation surgeries are normally performed under general anesthesia, so the patient does not experience any pain or discomfort during the surgeries. The incisions for eyelid surgery are concealed near the lash line so that the incisions are not even visible after a few weeks. Post surgery, the patient is given cold compresses and they have to continue applying ice compresses even at home. They can expect to have swelling on the eyelids or a bruising under the eyes, which may remain for 8 to 10 days. So people are normally able to resume office after 10 to 12 days post surgery. Of course, those of you who are on any blood thinners or any other comorbidities may take longer for the recovery, and it is therefore very important to follow the instructions of your doctor properly to heal at an adequate rate. The blepharoplasty surgery takes normally 1 to 2 hours, and it's a daycare surgery, so the patient can go home the same day. The results that we obtain after surgical rejuvenation of the eyelid area remain for many years. Of course, by following a healthy eating or a healthy lifestyle, we can maintain the results for much longer. The natural process of aging is going to catch up, but it will take many years before you start seeing a difference again in the eyelid area. For those of you who opt for non-surgical alternatives, you may need to do repetitive sessions at few months interval, and that's how you can maintain the rejuvenation in the under eye area. In order to decide which procedure is suitable for you, it is best if you discuss your goals and expectations, if you discuss the amount of time that you have in hand in terms of the downtime and what are the results that you expect to have. You can discuss your health status with your doctor. The best treatment plan according to me is to first let me assess the under eye area so that I am able to assess the severity of aging that you have, and then I can give you surgical and non-surgical alternatives which are suitable for your own needs. Of course, then we can have a mutual discussion about what single treatment or a combination of treatments would work the best for you. The eyes and the under eye area and the eyelids are very sensitive and they have very tiny nerves which supply these areas. So it is important to choose your surgeon wisely. When you opt for a board certified plastic surgeon with ample number of years of training and a good amount of experience, he or she can ensure that you get the best possible outcome and don't have any adverse event or complications following an eyelid surgery. If you liked this video, please like and share this video, and don't forget to subscribe to our YouTube channel for more such updates. You can click on the bell icon and you'll get